do I start? I think, what do I start with? Mum? Do I start with career?
All of it. Let's hear it.
I start with mum because I lead with that most of the time. Actually, it's connected to my PhD. So I am a mother of 3 boys, and my first little boy entered the world a bit like a wrecking ball, and he continues to be a force to be reckoned with. He's just starting his secondary school this year, so we're going through lots and lots of change at the moment. So that I think that's quite important because that will follow, be a bit of a theme through my PhD talk. So I started my career off in education. So I worked in the early years foundation stage, and then that was cut short by my first pregnancy, and then I decided that I would just have a family, home educated my children for a few years, and then sent them off to school after the lockdown because it kind of interrupted the homeschooling journey. They were ready to explore the world, and then I went back into teaching for a short time, but I had a few roles while I was home educating the boys. So one of the roles that I had was a doula. I don't know if anyone's heard of a doula. They are a birth worker, similar to a midwife in the support for women through pregnancy and birth, but we don't provide any clinical support. So that took up much of my years while I was home educating. And then I kind of went off into different bits of parenting support. So I've worked for a company that's based in the US called Clio as a family guide. I've worked for NHS England as a maternity service user representative. I worked on a national work stream for choice and personalised care, and a lot of that work was around kind of guidance and policy in shaping maternity services. So some of the outputs from that work was kind of like the personalised care planning. There were some days, Anna was there with me in her role. There were some kind of service user days that we ran and lots of events. And then through that work, I had kind of had this exposure because we had the lockdown, which kind of exposed many of the health inequalities, particularly in black maternal health. And at the same time, while that happened, around 2019, I started my master's. And the master's was started because of my own experience in relationship with birth in the UK, and I just started thinking about my mum and my grandmother, and I wanted to study the lives of enslaved women with a particular lens on reproductive health. I was very fortunate because at the time a brilliant book came out by Sasha Turner called
Contested Bodies.
That's it, Contested Bodies, and that was a brilliant resource for me because the lockdown happened and I could not access the archives that I needed to, and it shifted the focus of my master's. So that's kind of like my journey. It's a bit of a mishmash, but it's quite important because it does shape the PhD that I'm doing. So my master's was in English, my BA was in English, I've worked in the early years, I've worked in maternity, and now I work for the NSPCC, National Society for the Prevention of Cruelty to Children. So I still support children, and then I have a foot in the door through the PhD and other bits and pieces in maternity. I've done some work with birthrights. I sat on their panel for their inquiry into racial injustice in maternity services. Lots of little projects.
That leads me to ask the question, because you have such a I just want to ask you kind of what drew you to your PhD program. If you want to tell people where you are now, the kind of research you're planning on doing, and thinking about your broad background and your lived experience as well as your education, if you want to share a bit.
So the PhD is pretty much pulling together all those kind of threads in my life, and I really kind of, for me, the PhD is not just about impact, it is very much about that, because in the conversations that I had through all those different pieces of work that I was doing, I had more questions than we did have answers in a lot of the research that was being done at the time, how funding was being allocated to different research projects, who was getting funded, who wasn't getting funded, who was being funded to study us and our communities. And so that motivated me to always have a foot in the door in research. I kept all my connections through different, avenues of work, community organisations, researchers, people who were influential. And then I thought maybe I need to do the work for the questions that I have. And my children are growing up, and I'm saying, well, actually, I feel like a lot of what happened to me is kind of showing up in their lives, and I'm really curious about how much birth and care and relationships around that time of birth impacts a child's development. And so my research focuses on the relationship, if there is a relationship between maternity care and child developmental outcomes, and if there is a connection, how does that vary by ethnicity? And a lot of that is because as a birth worker, you can see that, they say that, care is a postcode lottery, and we were seeing that people who had the kind of gold standard maternity care were predominantly white women. Black and Asian women were risked out of that care, which is said to have positive outcomes on the woman and on the child, and they are supposed to have lifelong benefits. And so for me, it was really important to find out, and I didn't realise that had not been answered. I thought with all that we know about breastfeeding and early care, that there was some evidence, and actually it was a great question, and that's kind of how I was led to my PhD topic.
Yeah. Thank you so much, Natasha. So you have an educational background based in early years and humanities, but your PhD sounds to be very interdisciplinary, using qualitative and quantitative research methods. So what do you think helped you succeed in earning the funding to do your PhD? I guess we should mention that you applied for a PhD scholarship to do your studies, and you were awarded the scholarship at St. George's University of London. And so you come from a humanities background. What do you think helped you to be able to do this work in health and public health and using qualitative and quantitative research methods? Good question.
Okay, so just taking a couple of steps back. So I said that my BA and my MA was in English. So I do not have a quantitative bone in my body. And that is important. That's important in my own development, my career development, to challenge myself and step out of my comfort zone and actually challenge some of the beliefs that maybe might be instilled in some of us, particularly from minoritized backgrounds, that we may fit in a certain box, that we should only do qualitative, or we don't belong in data or science, or certain fields that may be dominated by men, and particularly you don't see a lot of Black and Asian women. And so that quantitative element was a little bit daunting, but I said I need to rise to the challenge and try something new. And that also coincided with this kind of career development and a bit of a career shift for me, in the sense that doing the PhD is an opportunity for me to change kind of the work that I'm doing and doing a role that hopefully once I complete is very meaningful to me. It's a career, I guess it's me being able to pursue something that allows me to specialise, and that's quite important from a personal perspective. And so that's kind of part of the reason why I chose to do a mixed method study. From the qualitative side, I wanted to kind of bring in a lot of that work experience, the observations I had made, and I can't make those assumptions because we're exploring throughout that research process, but it was trying to drawing on the experience, drawing on the kind of analytical skills I gained and the theoretical knowledge that I gained in the other degrees and other reading that I had done, and incorporating that. So it's a mixed methods in not just kind of quantitative and qualitative, but in also how theory will be applied and used throughout that PhD. And I think we're moving towards more kind of medical humanities in terms of how we do research, particularly if you're looking at health, because health is also social. It isn't just about biology and chemistry and all those other things. There's more to health than just clinical trials and observations. I hope that's a good question.
Yeah, no, that was great. So, Natasha, you are a success story. However, this didn't come without some challenges. So, what would you say made the difference between the first unsuccessful application to the program and the second successful application? So just if you want to share a little bit about what happened and what you learned from it.
So just to speak a little bit about the PhD application process. So one of the first things that was important is to find a supervisor. For me, maybe a little bit different for different people. If you'd not maybe got the experience that I had, where I had worked with many different researchers and things like that, had already had some relationships with different universities. So first of all, it's probably useful to see where you have relationships. And then you want to establish a good communication relationship with people so that you are finding out if the supervisor or the potential supervisors are right to support you through your PhD. So initially I had the first set of supervisors when I had my idea, and they supported me through it, but I wasn't successful. But the second time around, actually, I have a different team of people, so it wasn't the same first team who supported me through the successful application, and that was actually quite important. So the first time I didn't have a statistician as a supervisor, and the second time I did, and they were able to kind of really give me the language and the scaffolding to understand what's required to undertake this research. So the first time I was using probably terms that weren't really appropriate for the level that I was at, because the PhD isn't like the kind of cherry on the top, it's the beginning of your academic journey. And I had brilliant advice in a webinar I was listening to the other day, and she said, don't try and do it all. So it was really actually scaling back what I was saying in that initial application and keeping it really clean, really clear, and really simple. So the supervisors were really important. Anna, remind me of part of your question again. So just
what would you say made the difference between your first application? So you mentioned your supervisor.
That was really important. Being really clear on your ideas and understanding the aim limitations, what you can achieve within the time that you want to do that. Both times I applied for a funded scholarship, studentship. And so I will say that it's made it easier for me to access a PhD having a funded place, because it costs to be a student. It's not cheap being a student. So doing that has made it easier. Read widely, and take your time. Like the way that you do and put together your proposal is almost like a mini paper. So many of you, if you're doing your masters already, you're kind of used to that, and it needs to take a similar format, but it needs to be really concise and really condensed. So that's something that I think is really helpful, approaching it as though it is a paper and making sure you've got those key elements in there. I think something that was really useful for me was a bio. I don't know if everybody writes a bio in their applications, but I kind of set the context for who I was. I shared a bit about me, like I've shared today, the different parts of my life that has kind of brought me to this place of wanting to do this research, and why I feel I could do the research as well. And I identified my limitations and areas for development. So don't be afraid to not feel like you have everything in place. The point of the PhD is to develop some of that, and you just need to make it clear that this is my plan to do this research, that I will undertake such and such training and do this reading, this is what I've done so far. So that was really important in some of the application, different parts of the application as well.
So you touched on this a little bit, but if you could give any other advice to someone who's writing a PhD proposal, what would you say to them?
So I'm going to actually go back to a bit of advice I had when I was doing my A-levels, and it might be a bit controversial in terms of if it's good or not, that I was told to do what I would enjoy. This was when I was doing my undergraduate, by the way. Do what I would enjoy, because yes, we should do obviously what ties into our career kind of ideas that we want, but make sure you're going to enjoy that PhD. You are going to be tied to it for a very long time, And I had people who knew that I was interested in doing a PhD saying, why don't we put you down on this funding application for this big research project on something that just I had no interest in. Like, yes, it was maternity, yes, it was pregnancy, but it wasn't what I wanted to do. And I actually turned down quite a few, and I think people thought I was a little bit, crazy for declining to be put down on applications that were likely to be successful. But I really knew that if I was going to finish and complete the PhD, I needed to enjoy it. So make sure you're doing something that you're passionate about, something that you will enjoy. It's okay for it to stretch you, and it's okay for you to say to your supervisors that, there are some areas that I can develop. You can start some of your training now. If you already know that you want to do a PhD, you can start doing some courses now. They don't have to be, accredited big courses, but they want to see that you are making steps towards, filling any gaps in your knowledge and things like that. And that's some of the things that I did between the first application, which was unsuccessful, and the successful application. I went online on lots of different forums where you can get courses and just plugged gaps in my knowledge to just really enhance my CV. So you can start doing some of that now, and it doesn't have to be, the final, SPSS training or the official one. It can just be you doing a broader course that's on research methods or whatever it is you're looking at. So those are some things I think can be quite useful. And just make sure that you've got support as well. I think having supportive people, in your corner is really important, not just supervisors, but a colleague or a friend or another student, someone who can just say to you, etch away, keep going. You might not be successful the first time, try again. So you need someone who's in your corner a little bit as well, and I think that's really important and makes a difference. I don't know, Anna, if you feel the same way having that.
No, I'm smiling because I thought about the PhD proposal and how it's a big piece of work, and having that support, just someone saying you can do it, really makes a difference. So thank you so much, Natasha, for sharing your story.